In this session, we'll deal with the perineum 2, where we'll be studying the anal triangle and ischio fossa. So, structures which occupy pelvic outlet and lie below the pelvic diaphragm constitutes the perineum. In female, perineum body is considered as gynecological perineum. Pelvic outlet is diamond-shaped space. So, in front, it is bounded by lower border of pubic symphysis and arcade pubic ligament. Behind tip of coccyx. Anterolaterally, there is ischiopubic rami and ischial tuberosities. Posterolaterally, sacrotuberous ligaments covered by lower fibers of the gluteus maximus. So, this forms the boundaries of the diamond-shaped pelvic outlet. So, an imaginary horizontal plane joining anterior ends of ischial tuberosities divides the pelvic outlet into an anterior urogenital triangle and posterior anal triangle. So, urogenital triangle has been completed in the earlier session. Now, we'll be dealing with the anal triangle. So, in the midline, the anal triangle presents a perineal body, anal orifice, which is surrounded by sphincter ana externus muscle and anacoccygeal raphe. On each side presents a wedge-shaped space, the ischiorectal fossa. You can see here. So, this is the anal triangle where you can see this is the perineal body in the midline, and the anal triangle presents the perineal body, the anal canal, which is surrounded by the sphincter ana externus, and this is the coccyx. So, here you can see the anacoccygeal raphe. So, on either side, there will be a wedge-shaped space below the levator ani or the pelvic diaphragm. So, that will be the ischiorectal fossa. So, ischiorectal fossa, so it's a wedge-shaped space on each side of the anal canal. So, it is between the pelvic surface of the ischium and the inferior surface of the pelvic diaphragm. So, lateral wall is vertical and medial wall slopes downwards and medially. So, vertically, it's approximately 5 centimeters, anteroposteriorly 5 centimeters, whereas transverse is 2.5 centimeters. Let us see here the boundaries of the ischiorectal fossa. So, laterally, it is bounded by obturator internus muscle covered by the obturator fascia and the ischial tuberosity. Medially, levator ani muscle covered by anal fascia and sphincter ani externus. So, this wall will be sloping. I'll show you in the next diagram. You can see here, laterally by the obturator muscle, obturator internus muscle covered by the obturator fascia and the ischial tuberosity. So, medially, you can see the levator ani muscle covered by the anal fascia and sphincter ani externus. In front, transverse perineum superficialis and profundus muscle separated by the perineal membrane. So, behind the sacrotuberous ligament covered by the lower fibers of the gluteus maximus. So, apex is formed by fusion of anal fascia and obturator fascia. You can see here the apex is formed by fusion of the anal fascia with the obturator fascia. This part will become the apex. And you can see here the base is formed by the skin and superficial fascia. The base is formed by the skin and superficial fascia. So, as you observe here, the lateral wall is formed by the obturator internus muscle covered by the obturator fascia on the ischial tuberosity. The medial wall is formed by the levator ani covered by anal fascia and the sphincter ani externus. The apex is formed by the fusion of the anal fascia with the obturator fascia, and the base is formed by the perianal skin. As you observe here in the lateral wall, you can also see a pudendal canal with its contents, namely the pudendal nerve and its branches and the internal pudendal vessels. You can see the inferior rectal vessels traversing the space from lateral to medial wall. Here you can see the sphincter ani externus. Here you can see the conjoined fibroelastic sheath, which is formed by the fusion of the longitudinal muscle of the rectum with the levator ani. You can see here there are multiple septa coming. So, one of the largest septum is this. So, this particular septum, what you are seeing, this forms the perianal fascia. And if you observe clearly, there are three spaces. This is the suprategmental space above the tegmentum of the lunate fascia. So, if you observe the internal aspect of the obturator fascia and lunate fascia, there is an additional fascia here which is covering this ischiorectal fossa, that is the lunate fascia. So, the apex of which is called as, or the highest point of which is called as tegmentum. The ischiorectal fossa is divided into three parts, like the suprategmental space above the tegmentum of the lunate fascia and the ischiorectal space. So, this is between the tegmentum of the lunate fascia and the perianal fascia, and this will be the perianal space. So, perianal space, ischiorectal space and suprategmental space. So, let us see this in detail in further slides. So, this ischiorectal fossa also presents two extensions anteriorly and posteriorly. These are called as recesses of the fossa. The anterior recess, so it passes along the pubic arch above the deep perineal pouch, triangular and cross section. It is between the pelvic diaphragm above and the urogenital diaphragm below. Posterior recess is the backward extension to the side of the coccyx. It is between the sacrotuberous ligament and sacrospinous ligament. You can see here, this is the anterior recess of the ischiorectal fossa, which is triangular and cross section. So, above you can see the pelvic diaphragm, below you can see the urogenital diaphragm. So, here you can see this will be the anterior recess, and here you can see the posterior recess, which will be extending on either side of the coccyx. So, here If you see the facial dispositions of the fossa, so first and foremost is the lunate fascia. It is arranged in arch-like manner, lines the deepest part of the fossa. So laterally covers the obturator fascia as I have shown in the diagram, and forms the medial wall of pudendal canal and blends with the periosteum of the ischial tuberosity. So medially covers the anal fascia and blends with it at the level of Hilton's line of the anal canal. So we'll understand this Hilton's line, pectinate line when we study the anal canal Ross anatomy in detail. And the summit of the lunate fascia is known as the tegmentum, as I've shown in the earlier diagram. You can see here, this is the lunate fascia. Laterally, it is covering the obturator fascia, and here you can see it is forming the medial wall of the pudendal canal. This particular canal is the pudendal canal. The highest part is called as the tegmentum. This is called as the tegmentum. So now, if you observe here, the pudendal canal. So this is the pudendal canal. It is formed either by splitting of the obturator fascia or by the separation between lunate fascia and obturator fascia, or sometimes it might be formed by the splitting of the perianal fascia. So situated in the lateral wall of ischiorectal fossa, 2.5 centimeters above the ischial tuberosity, extends from lesser sciatic foramen to the posterior limit of the deep perineal pouch. Extends from lesser sciatic foramen. It is through this lesser sciatic foramen where the pudendal nerve and internal pudendal vessels enters into the pudendal canal, and it extends up to the posterior limit of the deep perineal pouch, which is a part of the urogenital triangle. Formation, either it is by splitting of obturator fascia, separation between obturator and lunate fascia, or by splitting of the perianal fascia. Contents are internal pudendal vessels and pudendal nerve and its branches. So if you see from above downwards, there will be dorsal nerve of penis or clitoris, internal pudendal vessels with the artery and vena comitatus, and the perineal nerve. So perineal nerve and dorsal nerve of penis or clitoris are the branches of the pudendal nerve. You can see here. So this is the pudendal canal or Alcock's canal with its contents. Now subdivisions of the ischiorectal fossa, as I have explained you in the beginning. Suprategmental space, it is between the apex of the fossa and tegmentum of the lunate fascia, which contains the loose fat. Here you can see. So this is the suprategmental space between the apex of the fossa and the tegmentum of the lunate fascia. Then you can see ischiorectal space between the lunate fascia and the perineal fascia, contains fat and fibrous tissue. You can see here. It is between the tegmentum and the perianal fascia, lunate fascia and the perianal fascia. So what is this perianal fascia? It is a lateralmost septum derived from fusion of the longitudinal muscle of rectum and anal canal. Then perianal space, it is between perianal fascia and skin, divided into numerous compartments by fibroelastic septa, and contains loculated fat. You can see this particular space will be the perianal space. So suprategmental space, ischiorectal space, and perianal space. So here there will be multiple septa dividing this into smaller compartments with loculated fat. So any kind of abscess here will have intense pain. So contents of ischiorectal fossa are the internal pudendal vessels, which are located in the pudendal canal, pudendal nerve. So again, this is also located in the pudendal canal. So it has two branches, the dorsal nerve of penis and perineal nerve. Inferior rectal vessels and nerve, which I have shown in the earlier diagram, they are traversing from lateral wall to medial wall. You can see here the inferior rectal vessels and nerve from lateral wall to medial wall. So then you can also see posterior scrotal or labial vessels and nerve, branches of the perineal nerve, which is a branch of the pudendal nerve, perineal branch of the fourth sacral nerve, and perforating branches of the second and third sacral nerve, and pad of fat. You can see here in the beginning diagram. I'll show you. You can see here. This is the perineal branch of the fourth sacral nerve, and these are the perforating branches of the second and third sacral nerve. Here you can see the inferior rectal vessels and nerve. Here you can see the internal pudendal vessels and the pudendal nerve with its branches. So applied aspects, the hiatus of Schwabe. So this is an opening when if the levator ani fails to arise from obturator fascia. So what happens? Then the pelvic viscera herniate into the corresponding ischiorectal fossa. Then the abscess, the fibrofatty tissue with blood supply, which is present in the ischiorectal fossa, is prone for infections, which results in abscess. So abscess in perianal space produces severe pain because of the compartmentalization and loculated fat. There will be stretching of the fascia resulting in severe pain. Then abscess can burst through skin producing external fistula, or abscess can burst through anal canal producing internal fistula, otherwise called fistula in nano. So abscess from one side can spread to the other side behind the anal canal, resulting in horseshoe shaped abscess. You can see here, this is the ischioanal abscess. Here you can see it is rupturing through the skin, creating an external fistula, and here it is rupturing into the anal canal, creating an internal fistula. So this is the abscess. So from one side you can go to the other side, resulting in a horseshoe shaped abscess. Thank you.